Good day, grade 10. Today is our MAPI 10 Health in 4th quarter, week 4. Again, my name is Rinaldo B. Malimban. In today's lesson, we talk about the objectives that the student to be able to provide an introductions to health systems. To know, to give an overview at the Philippine healthcare system using the WHO Health System Framework, and to illustrate, to present the potential rules medical students have Philippine healthcare system. Last time, we talked about the health issue trends in concern, a part of the global health issues. In the global health is the health of populations in the global context, which refers to the area of study, research, and the practice that places a priority on improving health and achieving equity in the healthy for all people worldwide. And today's topic, we talk about also the health in the Philippines. As we know that today in our country are very sad about the issue in COVID-19 or the pandemic. So healthcare in the Philippines vary from the private, public, barangay health centers are many rural municipalities. Most of the national burden of healthcare is taken up by the private health providers. Why? Because in 2000, the Philippines had about the 95,000 physicians, or about 1 per 800 people. In 2001, there were about 1,700 hospitals, of which about 40% were government run and 60% private, with a total about 85,000 beds, or about 1 bed per 900 people. So the leading cause of this case since 2002 were the diarrhea or pneumonia, influenza, hypertension, tuberculosis, heart disease, malaria, chickenpox, and measles. In cardiovascular diseases account for more than 25% of all deaths. Other estimates state that there may have been as many as 9,400 people living with HIV AIDS in 2001. According to World Heart Federation, in cardiovascular disease, the world's number one killer in cardiovascular disease are a group of disorders of the heart and blood vessels, commonly referred to as heart disease and stroke. We have 17.8 million deaths every year from CVD. 31% also of all global deaths, and 75% of CVD deaths take place in low and middle income countries. Aside from that, in the global causes of death, CVD is we have 78.8 million to cancer, 9.56 million, 3.9 million also the respiratory diseases, and the HIV we have 954,492. And what are some risk factors for CVD? We have the high blood pressure, high cholesterol, overweight or obesity, air pollution, physical inactivity, unhealthy diet, diabetes, tobacco, kidney disease, and harmful use of alcohol. The proposed of National Health Budget for 2010 is 28 billion, about US dollar 597 million, or 310 pesos in per person in the Philippines. Why? Because these generic medicines in the pocket expenses in the Philippines is term of value even with the 81% coverage of the country's healthcare system. We have the top 10 Philippine health agendas according to Dr. Willie T. Ong of the Philippine healthcare system as 10 important concerns to improve the health system of the Filipino. And what are they? Top 1 is to improve hospitals and health facilities. So this is the most basic problem. We not only need to increase the budget of these hospitals, but the hospital director should know how to manage the hospital efficiently, raise funds, and go into the public-private partnerships to quickly upgrade the hospital's capabilities. Second priority is to employ more health workers like doctors, nurses, and midwives. So we have surplus of around 200,000 nurses in the country, but we lack the funds to employ the needed health workers in our health facilities. Third, increase the PhilHealth enrolled and improve PhilHealth benefits. Why? Because this is the flagship program of the Aquino, former Aquino, from the health agenda of AHA, which also called in Universal Healthcare or Kalusugang Pangkalahatan. That also continue of our new president today, President Rodrigo Duterte. And number 4, also to reduce the maternal and infant deaths. So the Philippines has a high rate of mothers and infants dying. The current rate is 152 mothers dying per 100,000 live birth. So, what are some to decrease in maternal deaths? 8 strategies are: 1 is to increase the number of mothers to space checkups to screen for high risk pregnancies. Number 2, increase the hospital deliveries. Third, encourage mothers to space their pregnancies by 3 to 5 years. And what are also to reduce deaths? The strategies are: increase the hospital deliveries, not only for increase the number of the breastfeeding mother, increase the vaccinations, and also give the proper nutrition to the mother and child. Number 5 is to reduce non-communicable diseases. So these so-called the lifestyle diseases are the top causes of mortality in the Philippines. In this include heart disease, stroke, diabetes, high blood pressure, high cholesterol, obesity, and kidney diseases. So to address these medical conditions, the DOH or Department of Health needs to reduce the very high smoking prevalence in the country. 56% of the Filipino males smoke. Increase intake of fruits and vegetables. 3 out of 5 Filipinos do not eat enough fruits and vegetables. Increase physical activity and widen the access to cheap medicines. Number 6, to reduce the prevent cancer cases. So the cancer is the third leading cause of death in the country. In my research, the top 4 preventable cancers are the lung, the liver, the breast, and the cervix. Number 7 also include the lower of the cost of medicines. So the DOH is mandated to promote the generic medicines and to monitor the cost of essential medicines. Number 8, control dengue outbreaks. Why? Because dengue is basically tied up with environment sanitations. And we have to continue with the health informations campaign on the dengue prevention. Number 9, reduce the diarrhea outbreaks like the gastroenteritis or typhoid and cholera. So these diseases are related to the environmental sanitations. Ensure clean and safe water supply. And last, top 10 is to control the growing HIV/AIDS epidemic. A strong health information campaign on HIV transmission and safe sex with health. Let's another round from the view about the health issues in the Philippines. There are other important health issues like malnutrition, measles outbreaks, potential flu epidemic, road accidents, air pollution, firecrackers, the injuries, the rabies, dental health, mental health, newborn care, the eye care, the ear care, and many others. So each deserves our attentions and support. In the health issues in the Philippines, like other developing countries, has its own challenges and the problems to address. Each year, the continuous provisions for the healthcare needs to the people has been goal of the Philippine government. And here are some common health issues that the Philippines struggled with. Number 1 is the pneumonia. So during cold months, in the country, there is increase of incidence of pneumonia. So this pneumonia involves of the lungs and leads hospitalizations. Foreigners, especially those coming from non-tropical regions, are most the problem these diseases because they have to adjust to change of weather in the Philippines. Second is diarrhea. So this diarrhea outbreaks has been consistently on this rise in the Philippine soil, especially with the recent aftermath of Typhoon Kitsuna or Ondoy in the local name. Third is the leptospirosis. A more recent DOH problem involved the increase of cases of leptospirosis in the Philippines, particularly in the La Union and other flood-stricken areas. The onset of consecutive floods from the string of typhoons Ondoy and Piping caused contaminated water to fill the urban and rural areas. Next is the malnutrition. In our physical, emotional, and social factors contribute to this prevalent problem of the Filipinos. More underweight than overweight, Filipinos often have to consider the society's gap as primary factor. The ill distributions of wealth in the country of attributes to the most Filipinos having less food to eat on their plates. Next is H1N1 or swine flu. This flu virus scare really took the wind out of the boat sails as reduced the number of passengers on ships and other transportations moods that involved a lot of people. Why? Because these notable security measures were heightened in the airports and the other areas to prevent the outbreaks that happened in Giant Nueva Ecija. Shortly after the first case of H1N1 or flu virus has been reported last May 2009. Next is the illegal drugs. In the illegal drugs addiction, many Filipinos continue to fall victims to drug addictions. There are over 3.5 million habitual drug users in the country. and some of the national scandals in the past has been linked to the illegal drug use. The ongoing struggle against illegal addiction is an uphill battle. Next is the malaria. In malaria village in the remote areas in the Philippines are most susceptible to outbreaks of malaria. And the focus of improvement efforts are all there, locally and internationally. The lack of accessibility and the financial resource to get the best medical care in the chief cause of malaria infection in our country. Next is the tuberculosis. The Philippine Coalition Against Tuberculosis is just one of the many institutions that help alleviate this major Philippine health hazard. For decades, malaria has been established as one of the country's leading cause of deaths. Next is the heart disease or the hypertension. This is a very scary health problem. There has been steady increase and trends of hypertension among the Filipinos. 10. Cancer. A primary prominent person who died of this illness in the Philippines was the time of former President Corazon Aquino. Cancer is often found to be prevalent of urban areas with better treatment options. But cancer is quite difficult to treat for some cases. Our thoughts for today: sickness sometimes is a great blessing. People become angels through sickness, according to Spencer W. Kimball. That's all for today. For more updates and clarification, please send a comment of my personal messenger. Thank you. My name is Mr. Rinaldo B. Malimban.